This study is attempting to look at an important recent advance in the management of malignant lesions of the colon that present with large bowel obstruction. We know that colon cancer is the most common cause of large bowel obstruction, and the traditional treatment of it has been with emergency surgery, which might often require exteriorization and the performance of a stoma. In recent years, there have been numerous reports of metallic self-expanding stents that have been used to provide a bridge to surgery wherein the colon obstruction can be relieved and the definitive surgery undertaken in a more elective situation when many of the metabolic abnormalities have been corrected. However, what we still don't know is whether the long-term outcome for patients treated with metallic stents is acceptable. In this study, the authors have carried out a meta-analysis on published data up to May 2014, and as always, from the large number of studies that were available, or almost 500, they were able to find only about 11 that were acceptable in the nature of being randomized controlled trials with at least 3 years or more of patient follow-up. 1,136 patients were available from these 11 studies, and of these, about 432 were treated with metallic stents and the remaining 704 treated by the conventional method. The outcomes measured were 3 in number. They looked at 5-year overall survival, disease-free survival, and recurrence rates, and they compared stenting, the use of metallic stents, with conventional surgery. And in each one of those categories, 5-year overall survival, disease-free survival, and recurrence, there were no statistically significant differences. The authors thereby conclude that metallic stent insertion as a bridge to surgery could be a promising alternative strategy for the management of malignant large bowel obstruction patients. The study is a meta-analysis that included a fairly large series of patients, in excess of 1,000 patients, and by virtue of being a meta-analysis also allowed for fair comparisons. This study is therefore good and holds water.